Good day everyone. So for today, I am going to report about intrauterine device. So what are the intrauterine devices or the IUDs? An IUD is a small plastic device that is inserted into a woman's uterine cavity to prevent a pregnancy. So it releases copper or a hormone. Almost all IUDs have one or two strings or nylon threads tied to the plastic frame. So the strings hang through the cervical opening into the vagina. So an IUD is something like a T shape that is inserted into the woman's uterine to prevent a pregnancy. So in the Philippines, we have two types of IUDs that are available. So number one is copper or T380 or TCU. Then the second one is the hormone-releasing IUDs. TCU or 380 intrauterine device. How does IUDs are effective? So an IUDs are 99.4% effective with perfect use and 99.2% effective with typical use. So it is something like effective dyan siya na makaprevent siya pregnancies because it is 99.4%, unlike the other contraceptive device. Then these rates indicate that 992 to 994 of every 1,000 women who use IUDs over the first year will not become pregnant. So I can testify this kind of intrauterine devices. My sister or my elder sister uses this kind of contraceptive device. So she has only one child, and I think my niece is now in grade 9. So this IUD is very effective. So what are the advantages of using the TCU IUD? So it is highly effective, very safe, local action, has no effect on the amount or quality of breast milk, low cost, does not interfere with sexual intercourse, one-time application, immediate return to fertility upon removal, can be inserted immediately after childbirth or after abortion, long-lasting or effectiveness for 12 years. So it is highly effective, as what I've said a while ago, and it is very safe. Then someone will ask if they can interfere with during the sexual intercourse, but it's not. The IUD is not does not interfere with sexual intercourse, and this is only one-time application. Just unlike the other pregnancy contraceptive device or pregnancy hormonal controls, they are more likely mabalik sila every 3 months or every day, just like the pills. You have to take the pills every day. So the IUD is very safe, and it is a one-time application only. Then it is a long-lasting effectiveness for 12 years. Diba? How effective the IUD is. It long lasts for 12 years. Then what are the disadvantages of using the TCU IUDs? So adverse effect. So this can be the adverse effect during the insertion or after the insertion of the IUD. So pain and cramping. So you might feel pain and cramping in your abdomen, and then long and heavy menstrual bleeding. So maybe you can feel this kind of menstrual bleeding, and then menstrual irregularities. Then the device may be expelled possibly without the client knowing it, especially for postpartum insertions. It requires a pelvic examination prior to insertion. So i-examine tayo mo hang pelvic if the IUDs is kuan ba siya hanang pwede ba siya nimo to insert prior to the insertion. And then it requires a trained health service provider for insertion and removal. So of course, a trained health service provider jud ang pwede nga ma-insert. It doesn't mean that you're a healthcare it doesn't mean that you're a healthcare practitioners, but you are not trained with insertion of the IUD, so you are not the one who will insert it to someone who will use the IUD. So must be trained. It requires that the personnel or the healthcare practitioners that is already trained about the insertion and the removal. Then does not protect against sexually transmitted infections. So ang IUD is not necessarily or dili siya makaprotect against the sexually transmitted infection or the STIs or even in the HIV, since it is just like inserted in your cervix. Then it requires regular self-checking of IUD strings during the first year of use. Then how does the TCU IUD works? The TCU 380A IUD prevents pregnancy by a combination of the following mechanisms of action. Number 1 is inhibition of fertilization. Inhibition of sperm transport into the upper genital tract. Inhibition of ovum transport. How is the IUD used? So the timing of IUD insertion. For women having menstrual cycle. So dili siya pwede i-insert unless the women having her menstrual cycle. So i-insert yun siya kung gidugo ang babae. So anytime during menstrual bleeding. So pwede siya basta gidugo ang babae para soft and smooth ang pag-insert. Then any other time at the client's convenience, provide that the client is certainly not pregnant. Of course, dili siya pwede insert if nabdos siya. So make sure that if you will use IUD, you are not pregnant. Then clients starting within 12 days after the start of their monthly bleeding do not need a backup method. So dili na ka need of backup method, just like the backup method is most likely ang condoms. So you don't need a backup method after 12 days after the start of their monthly bleeding. Then for amenorrheic or non-postpartum women, anytime provided that the client is certainly not pregnant or no need for a backup this time. So for the amenorrheic amenorrheic is the absence of menstruation. So you don't have to use a backup method. Then after childbirth or postpartum, within 10 minutes after delivery of placenta or within 48 hours, so kung ano siya, pwede na siya i-insert ang IUD. Pwede na ka mo use og IUD after 10 minutes nga ma-deliver na or magawas na yung inunlan or the placenta. So after childbirth, the copper IUD is not usually recommended for women more than 48 hours to less than few weeks postpartum, unless other more appropriate methods are available. IUD insertion is delayed until your weeks or more after giving birth. Special training is required for immediate postpartum insertion. So as what I've said, the trained healthcare providers can insert it, especially for those who have postpartum insertion. Good. Inserting the IUD. So only a provider who has undergone comprehensive IUD training and practice under direct supervision is allowed to perform IUD insertion. So I have said it a while ago that only a provider or the one that is trained who has the right to insert or to perform the IUD insertion. Then the IUD must be placed correctly, hyphandal position, while minimizing the client's discomfort and the risk of uterine perforation. So if you are the one who are trained with IUD insertion, so you must be placed it correctly with comfort for your client so that they may not feel discomfort. Okay, so what are the potential complications and management procedures of IUD? So prolonged or heavy bleeding, cramping, missing string, pregnancy with IUD, pelvic inflammatory disease, or uterine perforation, partial expulsion, partner can feel IUD string during sex. So these are just a potential. So mga posible na nga mahitabo if ma-misplace or na times nga ang kuan is not that just kind of kanabang properly inserted. Then the client may feel prolonged heavy bleeding. Then mag-cramping ang iyahang abdomen or iyahang puso, dapit. Then missing string. Sometimes the IUD is mawalaan siya og string. Then pregnancy with IUD, this is dili kay ni siya mahitabo kay 99.4% man effective ang IUD, but this is just a potential, mga posible ra nga mahitabo. And then partner can feel IUD string during sex. So sometimes makaingon sila nga ma-feel nila during the sexual intercourse, but this is just kanadang dalagsa siya or yeah. What are the indications for IUD removal? When and how should the IUD be removed? When the client's request for or develops medical conditions that require IUD removal, the provider should not refuse or delay the removal. Staff members must not pressure or force the client to continue using the IUD and instead offer her alternative family planning method. So if imong clients, if you're the one who are trained for the IUD insertion, so you have no rights to force your clients if she requested nga ipa-remove na ang iyang IUD for some reason. So you can offer the alternative family planning. We have pills man po, we have other kuan man po nga katong injectables. So you can offer them. Then presence of side effects, especially pain and bleeding, which are intolerable to the client. So the medical reasons is pregnancy if threads are visible. So when to remove the TCU IUD? When the effective lifespan of the IUD has been reached, recommend the replacement of copper IUDs at the end of the 12th year of use, at menopause at least 1 year after the last period, anytime during the menstrual cycle. So, when to remove the IUD? So, kuan siya, if ma-reach na nimo ang iyahang effective lifespan, like it is 12 years. So, maabot na siya 12 years, pwede na siya nimo i-remove, but then, during your menstrual cycle. So, gi-insert nimo siya during your menstrual cycle, imo po siyang i-remove na gidugo pug ka. Then, how to remove the TCU IUD. So, if you are the one who are trained for that IUD insertion and removal, follow proper infection prevention procedures. Of course, you have to follow it. Then, insert the speculum to visualize the cervix and the IUD strings. Then, grasp the strings with forceps. Pull IUD strings slowly and gently to avoid discomfort for your client. Then, what happens when IUD is removed? The IUD is a reversible means of contraception. Most women discontinue IUD use to become pregnant, conceive as rapidly as a non-IUD user. Sufficient evidence indicates that no relation exists between the duration of IUD use and the return to fertility. Then when should the follow-up visit or schedule? A follow-up visit after the client's first monthly bleeding or 3 to 6 weeks after IUD insertion is recommended. The new client should be denied an IUD because follow-up would be difficult or not possible. Follow-up visits after insertion may be done.
So, what counseling tips can be provided for those who plan or choose to use an IUD? Characteristics of IUDs: client, current, and future risk of STIs, effectiveness and mechanism of IUD, insertion and removal procedures, interaction for use and follow-up visit, possible side effect and complication, how to check the strings, warning signs of complication that requires immediate return to the clinic or referral. So, pain. P for period is late. A, abdominal pain during intercourse. I, infection and not feeling well as string is missing. If you feel makakuan ka nga pain, you consult your healthcare provider. Then, what are the commonly asked questions about IUDs? Does the IUD cause PID? Can young women and older women use IUD? If a current IUD user has an STI or has become at very high and individual risk of becoming infected with an STI, should her IUD be removed? Does the IUD make a woman infertile? Can be woman who has never had a baby use an IUD? Can the IUD travel from the woman's uterus to other parts of her body, such as her heart or her brain? So, number 7, should a woman have rest period after using her IUD for several years or after the IUD reaches its recommended time for removal? Should antibiotics be routinely given before IUD insertion? Most an IUD be inserted only during a woman's monthly bleeding? Should a woman denied an IUD because she does not want to check her IUD strings? Do IUD increase the risk of ectopic pregnancy? Those are the common questions about IUD. Thank you and God bless.